Can genetics guide your ideal protein intake for kidneys? Imagine your body as a finely tuned machine, where every part has a role, including your genes. When it comes to managing your kidney health through diet, especially protein intake, your genetics might play a part, but how much they influence is still being explored. Protein is essential for building tissues and repairing cells, but for those concerned about kidney health or kidney cancer, the amount you need can vary based on several factors. These include your current kidney function, overall health, and increasingly, your genetic makeup. For most people with healthy kidneys, eating a moderate amount of protein is safe and beneficial. However, if you have chronic kidney disease, or CKD, your kidneys are gradually losing their ability to filter waste. Eating too much protein can make the kidneys work harder because breaking down protein produces waste that must be filtered out. Over time, this extra workload can lead to further damage. Medical guidelines recommend that people with CKD limit their protein intake to about 0.6 to 0.8 grams per kilogram of body weight daily. This helps slow disease progression but still provides enough protein to prevent malnutrition. Because each person's situation is unique, it's important to work with a healthcare provider or dietitian to find the right balance. Now let's talk about genetics. While most dietary guidelines are based on broad population data, new research suggests that your genes might influence how much protein is best for you. Some people have genetic variations that affect how their bodies process protein or respond to dietary changes. For example, in genetic kidney conditions like polycystic kidney disease, or PKD, protein recommendations might differ from those for other types of CKD. Early studies indicate that some individuals with specific genetic profiles may tolerate higher or lower protein intakes without adverse effects. Researchers are also investigating how genetics influence inflammation, how your body metabolizes protein, and even your gut bacteria, all of which can impact kidney health. However, it's important to note that this research is still in its early stages. Currently, there is not enough evidence to routinely use genetic testing to determine the ideal protein intake for kidney health in the general population. Most recommendations continue to focus on kidney function assessments and personalized medical advice. When it comes to kidney cancer, the link between protein intake and disease risk is less clear. For survivors, maintaining a balanced diet that supports overall health is usually the main goal. Unless there is kidney dysfunction, protein restrictions are generally not necessary. If kidney function is affected by cancer treatments or other factors, then following your doctor's advice on protein intake is essential. In practical terms, the best approach right now is to follow evidence-based guidelines based on your kidney health. If you have a family history of kidney disease or a genetic condition like PKD, discuss your diet with a specialist. Regular kidney function tests can help catch any changes early, allowing you to adjust your diet accordingly. While the idea of personalized nutrition based on genetics is promising, it's not yet standard practice. As research advances, we may see more tailored recommendations in the future. To sum up, most people can safely consume moderate amounts of protein, but those with kidney issues should be cautious and follow medical advice. Genetics might influence how your body handles protein, but current science does not support routine genetic testing for setting dietary protein goals. For those with inherited kidney conditions, personalized plans are important and should be monitored regularly. If you are a kidney cancer survivor, focus on overall balanced nutrition unless your doctor advises otherwise. Always consult your healthcare team for guidance tailored to your specific needs. As our understanding of genetics and kidney health grows, personalized nutrition could become more common, but for now, listening to your body and working with professionals remains the best way to support your kidney health.